Hi everyone, this is JP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today it's our session number 3 for series Image Spotter. This series is targeting upcoming exam NEETPG, FMG and INICET. NEETPG in month of May and FMG in month of June, year 2022. My dear friends, if you are consistent with me from our other series like Super 1000 Question series and MCQ Blaster series and now Image Spotter series, if you are consistent with me, if you are following me, then you are surely going to get good grades in your upcoming exam, whether it is NEET PG, FMG, INICET, because we are practicing every type of question, whether it is image based question, whether it is clinical integrated, okay, whether it is and one liner question. Okay, so in super 1000 question we have completed 50 parts and we have practiced all 19 subjects for multiple times. In MCQ Blaster series we covered complete medicine in integrated pattern, in clinical way, and also image based. Okay, so if you are unknown from all these parts, then you must go on my channel and you must watch MCQ Blaster series and you must watch our Super 1000 question series, because we have practiced all 19 subjects for 4 to 5 times and we have practiced more than 1000 questions in Super 1000 question series. And now we are going to practice image in this image spotter series, and today it's our session number 3 for this series, and we practice 5 image and we have a pattern to practice the image. Okay, what is the pattern? Pattern is that first you will see the image. I will give you 10 seconds to think about that image. Then I will give you correct answer for that image without option. ये simple एक pattern है जो मैं समझता हूँ कि you can retain the image for long time. ओके, पहले तुम इमेज को देखोगे, उसके बाद इमेज को देखने के बाद यू हैव टू इमेजिन, यू हैव टू थिंक अबाउट दिस इमेज, दैट इसका आंसर क्या हो सकता है. क्लोज योर आइज एंड क्रिएट एन same image in your imagination and think that yes, this can be its answer, and after 10 seconds you will see that yes, I am thinking very correct. And if you are not thinking correct, then after watching the correct answer you have to correlate that image and that answer all together. And if you will follow this pattern with me, then you are going to retain all the images for a long time, and these image retained in your brain will help you to get good scores in your upcoming exam. So let's start from our first image. Here we go. You have to choose correct diagnosis for this image. 10 seconds for you. So my dear friends, here you go. It is coffee bean appearance. Okay, so you have to now imagine this image in your brain, and you have to correlate this, that yes, here it is coffee bean appearance is shown. Okay, you have to correlate this thing. If you are eligible in correlating this image correctly, then you are surely going to get the answer correct in your upcoming exam. Okay, you can see like this. Okay, and other part is here, it's like coffee bean. Okay, now let's go to our complete solution for this image. Here we go. Coffee bean appearance, bean sign, also known as kidney bean sign or bent inner tube sign. It is a radiological finding on an abdominal plane radiograph of sigmoid volvulus. Although you can see it is as a term referring closed loop small bowel obstruction. Okay, you can also see it is in closed loop small bowel obstruction. So you can here clearly see two images. Okay, one is this and one is this. Here both are clearly showing you coffee bean appearance. Okay, so now let's see another sign for sigmoid volvulus, and that is, here you go, bird beak sign. Okay, it represents gradual narrowing tapering of sigmoid colon up to the level of obstruction during contrast or barium insertion to the rectum or on CT. And you can see when located in sigmoid colon, it will suggest diagnosis of sigmoid volvulus. Okay, so here you can see sigmoid volvulus diagnosed by this beak sign, bird beak sign. Okay, and it is also used to refer the tapering of inferior esophagus in case of eclasia. ओके, प्राइमरी एक्लेसिया की जो कंडीशन है उसमें भी बर्ड बीक साइन क्या है, यूजफुल होता है डायग्नोस करने में कि यस इट इज अ केस ऑफ एक्लेसिया. Okay, primary eclasia, and this sign, this appearance also referred as red tail sign. Okay, so two signs are clear up to you. So my dear friends, here you have 10 seconds to think about this image. It's our second case. Okay, and the correct answer for this question will be close sign. Okay, close sign, it's like an leg of a bird. Okay, here you can see it clearly. Okay, it's looking like this, and we can see that where we can see the close sign. So here you go, it is a radiological classic sign which will help you to differentiate between Wilms tumor from neuroblastoma. It is identical sign seen in Wilms tumor. Okay, and you can differentiate meningioma, Wilms tumor, and renal angiomyolipoma. Okay, you can differentiate meningioma by intraaxial brain tumor because it is seen in meningioma. You can see it in Wilms tumor, and it will help you to differentiate it from neuroblastoma. Renal angiomyolipoma, you can see this in renal angiomyolipoma, and it will help you to differentiate it from retroperitoneal liposarcoma. Okay, so it is seen in meningioma, Wilms tumor, and renal angiomyolipoma. You can see it is as mimicking the shape of crab or lobster claw. Here you can see in this image, okay, clearly mentioned here that it is mimicking as lobster claw, okay, or a shape of crab. So my dear friends, and here you can also read the detail about claw sign, that it is refers to sharp demarcation between the tumor and normal renal parenchyma, producing a sharp angle on both sides of mass. Okay, so three images we have completed till now. Okay, it is our second case, but we completed three images, three sign. Okay, you must remember all this sign. Create an image in your imagination, then interlink that answer with that image. You will get your correct answer for your upcoming exam. Here, so my dear friends, it's our image number 3, and here you have 10 seconds to think about this. See this image clearly, because now soon we are going to read detail about this image. So let's see. It is string of contour sign. Where we can see it in? We can see it in case of Crohn's disease. Okay, and now we also must know that where we can see except Crohn's disease, मतलब Crohn's disease में देख सकते हैं, उसके अलावा भी कहीं देख सकते होंगे ना. Yes, we can. But here we go. Gastrointestinal string sign, also known as string sign of contour, refers to the string-like appearance of a contrast-filled bowel loop caused by its severe narrowing. Originally, it is used to describe reversible narrowing caused by spasm in Crohn's disease, and it is now used for any severe narrowing of bowel lumen, including that it is seen in hypertrophic pyloric stenosis, gastrointestinal tuberculosis, carcinoid tumor, and colon cancer. So from here you can make a list that where you can see string sign of contour. You can see it in Crohn's disease, hypertrophic pyloric stenosis, gastrointestinal tuberculosis, carcinoid tumor, colon cancer. Total 6 places, total 6 disorder that you can see the string sign of contour. Okay, let's go to our image number 4. Here you go. Choose correct answer, my dear friends. 10 seconds. So, my dear friends, correct answer for this image will be Cobra head sign. Okay, Cobra head sign. where you can see this cobra head sign. So my dear friends, you can see this in condition of, or it is also known as spring onion sign, and it refers to dilation of distal ureter surrounded by thin lucent line, which is seen in patient with adult type uterocele. सो कोबरा हेड साइन किस में दिखेगा? यूटेरोसेल के केस में, और ये रिप्रेजेंट किसको करेगा? डायलेटेशन ऑफ डिस्टल यूरेटर. द कोबरा हेड अपीयरेंस इंडिकेट्स एन अनकॉम्प्लिकेटेड यूटेरोसेल. सो कोबरा हेड साइन रिप्रेजेंट क्या करेगा? डायलेशन ऑफ डिस्टल यूरेटर. सीन किस में होगा? यूटेरोसेल के केस में, और ये इंडिकेशन क्या देगा कि ये एक अनकॉम्प्लिकेटेड केस है यूटेरोसेल का. सो ये भी क्लियर हो चुका है माय डियर फ्रेंड्स. ओके, so you can see this clearly in this image. And my dear friends, now let's go to our last image for the day. My dear friends, it's our image number 5 and last image for the day, and here you have 10 seconds again to think about this image. So my dear friends, answer of this image will be inverted Napoleon hat sign. Here you can see clearly it is mentioned by arrow marking Napoleon, inverted Napoleon hat. Okay, it's like inverted Napoleon hat, and it is seen in which case? You have to think it now. Okay, you have to link that inverted Napoleon hat sign. Yes, I know it. You can create the image, but where you can see? So my dear friends, here we go. Inverted Napoleon hat sign. It is seen in case of bilateral spondylolysis with marked enterolithsis of L5, or in case of marked excretion of normal lordosis at the lumbosacral junction. Inverted Napoleon hat sign. It is a radiologic sign seen on frontal, pelvic or lumbar radiograph at level of fifth lumbar vertebra and sacrum. Okay, so my dear friends, 5 images for the day are done. 5 important images for the day are done. I hope that you all enjoyed this session. If you feel that this session is helpful, then you have to do 3 things. Like this session, share this session, and do subscribe to my channel for more updates. Thanks to everyone for watching this session till end. And if you feel that this session is helpful, then you can also comment in comment box that yes, we need more session like this. Okay, and do watch other series going on my channel, that is super 1000 question series and MCQ blaster series and image series in front of you. This is what how we practice images for long term retention in brain. This is what I think that yes, if you do follow this pattern, then you can retain the image for a long time. Okay, so thanks to everyone. Stay safe, stay healthy.